Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today, we're learning about episiotomy. So go ahead, subscribe, and let's get started. Students, now, let us understand what episiotomy means. Episiotomy is a surgical cut made in the perineum, which is the area between the vaginal opening and the anus. This procedure is usually performed during the second stage of labor, when the mother is actively pushing the baby out. The purpose of this incision is to enlarge the vaginal opening and make the delivery of the baby easier and safer. In some situations, the healthcare provider may perform an episiotomy to help with childbirth and to prevent severe tearing of the tissues. It is important to remember that episiotomy is not done routinely for every mother. It is performed only when there is a medical need. So, in simple terms, episiotomy is a surgical incision made in the perineum during childbirth to widen the vaginal opening and facilitate the birth of the baby. Students, now let us discuss the objectives of episiotomy. The first objective is to enlarge the vaginal outlet during delivery. By increasing the size of the opening, the baby can pass through more easily. Another objective is to prevent uncontrolled perineal tears. A planned surgical incision may sometimes be better than irregular tears that can occur naturally during childbirth. Episiotomy can also help shorten the second stage of labor when necessary. This is especially important when delivery needs to be completed quickly for the safety of the mother or baby. It also facilitates instrumental delivery, such as forceps delivery or vacuum extraction. The extra space created by the incision helps the healthcare provider use these instruments safely. Another important objective is to reduce fetal distress by speeding up delivery. If the baby is showing signs of distress, an episiotomy may help in delivering the baby more quickly. Therefore, the main goals of episiotomy are to assist childbirth, protect maternal tissues, support instrumental delivery, and ensure the safety of both mother and baby when medically indicated. Students, now let us discuss the indications for episiotomy. Indications mean the situations in which an episiotomy may be necessary. One important indication is fetal distress requiring rapid delivery. If the baby is not tolerating labor well, the baby may need to be delivered quickly, and an episiotomy can help speed up the birth. Another indication is instrumental delivery, such as forceps or vacuum extraction. In these cases, extra space may be needed to safely assist the delivery. Episiotomy may also be performed in shoulder dystocia. This is a condition where the baby's shoulder gets stuck after the head is delivered, making childbirth difficult. Breech delivery is another indication. In breech presentation, the baby comes out feet or buttocks first, and an episiotomy may help facilitate delivery. Sometimes, the mother may have a rigid or inelastic perineum. When the tissues do not stretch adequately, an episiotomy may help prevent severe tears. A large baby, also known as macrosomia, can make vaginal delivery difficult. In such situations, an episiotomy may be considered to assist childbirth. Episiotomy may also be performed in preterm babies to reduce trauma to the fetal head, as premature babies have more delicate tissues. Therefore, episiotomy is performed only when there is a specific medical indication and when it is expected to benefit the mother or baby during delivery. Students, now let us learn about the first type of episiotomy, which is the median or midline episiotomy. In this type, the incision starts from the center of the fourchette, which is the posterior part of the vaginal opening, and extends straight towards the anus along the midline. One advantage of this type is that there is usually less blood loss because fewer blood vessels are cut during the incision. Another advantage is that it is easier to repair after delivery. Since the incision is straight, suturing becomes simpler and healing is often better and faster. However, this type also has an important disadvantage. There is a higher risk that the incision may extend into the anal sphincter if the tear continues during childbirth. Therefore, although median episiotomy has benefits like less bleeding and better healing, it must be performed carefully because of the risk of extension into the anal region. Now, let us discuss the second type of episiotomy, which is mediolateral episiotomy. In this type, the incision starts at the midline of the perineum and then extends sideways at an angle of about 45 to 60 degrees. This means the cut moves away from the anus, rather than directly towards it. This is the most commonly used type of episiotomy in many hospitals because it is considered safer in certain situations. One major advantage of mediolateral episiotomy is that it has a lower risk of extending into the anal sphincter. Therefore, it reduces the chance of severe perineal injury. However, compared with median episiotomy, this type may cause more pain and blood loss because more tissues and blood vessels are involved. Repairing this incision may also be slightly more difficult, and healing can sometimes take a little longer. So in summary, mediolateral episiotomy is the most commonly used type because it offers better protection against anal sphincter injury, although it may be associated with increased pain and bleeding. Now, let us learn about the third type of episiotomy, which is lateral episiotomy. In lateral episiotomy, the incision does not start from the midline. Instead, it begins about 1 to 2 centimeters away from the midline and extends laterally. This type was developed to reduce the chance of the incision extending into the anal sphincter. However, lateral episiotomy is not commonly used in clinical practice. This is because it may cause increased bleeding due to injury to blood vessels in the area. There is also a greater risk of damage to nearby structures, such as nerves and glands around the perineum. Because of these disadvantages, lateral episiotomy is rarely preferred, and mediolateral episiotomy is more commonly used in obstetric practice. So, in simple terms, lateral episiotomy starts away from the midline, but it is rarely used because of increased bleeding and the risk of injury to surrounding tissues. Students, now let us learn about the J-shaped episiotomy. In this type, the incision begins at the posterior fourchette in the midline. The posterior fourchette is the back part of the vaginal opening. After extending for a short distance, usually about 2.5 centimeters, the incision curves sideways, giving it a J shape. This curved design is important because it directs the incision away from the anus. As a result, it helps reduce the risk of the cut extending into the anal sphincter and rectum, which are serious complications. J-shaped episiotomy combines some advantages of both midline and mediolateral episiotomies by providing more space for delivery while protecting nearby structures. However, this type is not commonly used in routine practice and is selected only in specific situations. So in simple terms, J-shaped episiotomy starts in the midline and then curves away from the anus to reduce the risk of injury to the anal sphincter and rectum. Students, now let us understand the procedure of episiotomy step by step. The first step is to explain the procedure to the mother. This helps reduce anxiety and ensures that she understands why the procedure is being performed. Next, strict aseptic precautions should be maintained to prevent infection. Proper hand hygiene, sterile gloves, and sterile instruments must be used. If required, local anesthesia is administered to reduce pain and provide comfort to the mother during the procedure. The episiotomy is performed during a uterine contraction when the fetal head is crowning. Crowning means the baby's head is visible at the vaginal opening and no longer goes back inside. At this stage, the incision is made using episiotomy scissors. After the incision, the baby is delivered safely. Once the baby is born, the placenta is delivered. The healthcare provider then carefully inspects the episiotomy and surrounding tissues to identify any tears or injuries. Finally, the episiotomy is repaired in layers using sutures. Proper suturing helps control bleeding, promotes healing, and restores the normal anatomy of the perineum. So the procedure of episiotomy includes preparation, making the incision at the appropriate time, delivery of the baby and placenta, inspection of tissues, and repair of the incision. Students, after an episiotomy is performed, the incision must be repaired properly to promote healing and restore normal anatomy. The repair of an episiotomy is usually done in 3 layers. The first layer is the vaginal mucosa. This is the inner lining of the vagina. Suturing this layer helps close the incision and control bleeding. The second layer is the perineal muscles. These muscles provide support to the pelvic floor and help maintain the strength and function of the perineum. Careful repair of the muscles is important for proper healing. The final layer is the skin. The skin edges are brought together using sutures to complete the repair and promote good wound healing. Repairing the episiotomy layer by layer helps restore the normal structure of the perineum, reduces bleeding, promotes faster healing, and lowers the risk of complications. So remember that episiotomy repair is performed in 3 layers: vaginal mucosa, perineal muscles, and skin. Students, now let us discuss the complications of episiotomy. Like any surgical procedure, episiotomy can have both immediate and late complications. First, let us look at the immediate complications, which occur soon after the procedure. Bleeding is one of the common complications because blood vessels may be cut during the incision. Pain is also common, especially in the perineal area, and it may cause discomfort while sitting, walking, or passing urine. Another complication is hematoma formation. A hematoma is a collection of blood under the tissues due to bleeding from injured blood vessels. Infection can occur if proper hygiene and aseptic precautions are not maintained. Sometimes the incision may extend beyond the intended area and involve deeper tissues. This is known as extension of the incision and may lead to further complications. Now, let us look at the late complications, which may appear weeks or months later. Delayed wound healing can occur due to infection, poor blood supply, or improper wound care. Some women may experience dyspareunia, which means pain during sexual intercourse after healing. Scar tenderness may also occur, where the healed scar remains painful or sensitive. Perineal discomfort, such as persistent pain or discomfort in the perineal region, may continue for some time. Rarely, if severe injury involves the anal sphincter or surrounding structures, fecal or urinary incontinence may occur, meaning loss of control over bowel or bladder function. Therefore, proper technique during episiotomy, careful repair, and good postnatal care are essential to prevent these complications. Now, let us look at the late complications, which may appear weeks or months later. Delayed wound healing can occur due to infection, poor blood supply, or improper wound care. Some women may experience dyspareunia, which means pain during sexual intercourse after healing. Scar tenderness may also occur, where the healed scar remains painful or sensitive. Perineal discomfort, such as persistent pain or discomfort in the perineal region, may continue for some time. Rarely, if severe injury involves the anal sphincter or surrounding structures, fecal or urinary incontinence may occur, meaning loss of control over bowel or bladder function. Therefore, proper technique during episiotomy, careful repair, and good postnatal care are essential to prevent these complications. Students, now let us discuss the nursing responsibilities during the procedure. One of the most important responsibilities of the nurse is to maintain aseptic technique throughout the procedure. Strict asepsis helps prevent infection and ensures the safety of both the mother and the baby. The nurse should also assist the healthcare provider during the procedure by providing sterile instruments, preparing materials, and offering support whenever needed. Another important role is to continuously monitor the condition of both the mother and the fetus. The nurse should observe the mother's vital signs, comfort level, and progress of labor, while also monitoring the fetal heart rate to identify any signs of distress. Good communication and prompt action by the nurse can help ensure that the procedure is performed safely and effectively. Therefore, during the procedure, the nurse plays a key role in maintaining sterility, assisting the healthcare provider, and closely monitoring maternal and fetal well-being. Students, now let us discuss the nursing responsibilities after the procedure. The first responsibility is to assess the mother for pain and bleeding. The nurse should regularly check the level of pain and observe for excessive bleeding, as early detection helps prevent complications. The nurse should also observe the wound for signs of infection. Redness, swelling, discharge, foul smell, or increased pain may indicate infection and should be reported immediately. Maintaining good perineal hygiene is very important for proper healing. The perineal area should be kept clean and dry to reduce the risk of infection. The mother should be encouraged to take adequate fluids and nutritious food. Proper nutrition and hydration promote tissue repair and faster wound healing. The nurse should teach the mother about perineal care, such as cleaning the area correctly and changing pads regularly. Pelvic floor exercises, such as Kegel exercises, can also be taught to strengthen the pelvic muscles and improve recovery. Prescribed medications, including pain relievers or antibiotics, should be administered as ordered by the healthcare provider. Therefore, after the procedure, nursing care focuses on relieving pain, preventing infection, promoting healing, and educating the mother for a smooth recovery. Students, now let us discuss the postnatal care of an episiotomy wound. Proper care is very important to promote healing and prevent infection. The first step is to keep the perineal area clean and dry. Good hygiene helps prevent the growth of microorganisms and promotes faster healing. Perineal pads should be changed frequently, especially when they become wet or soiled. This helps maintain cleanliness and reduces the risk of infection. Warm sitz baths may be used if prescribed by the healthcare provider. A sitz bath helps relieve pain, reduce swelling, and improve blood circulation to the area, which promotes healing. Early ambulation, or walking soon after delivery, should be encouraged, as it improves circulation, prevents complications, and helps the mother recover faster. Proper hand hygiene is also very important. The mother should wash her hands before and after touching the perineal area or changing pads to prevent infection. The mother should be advised to report any warning signs such as excessive pain, swelling, foul-smelling discharge, or fever, as these may indicate infection or delayed healing. So, proper postnatal care of the episiotomy wound includes maintaining hygiene, ensuring comfort, promoting healing, and identifying complications at an early stage. That's the end of this video. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.